Hello everybody, I'm Sheila Sampath from the course HAS 820. Today I present to you Australia's aging population and related public health. I'll start off with a broad introduction about aging worldwide before getting into the specifics about Australia. We'll be exploring the numbers, the changing demography, and the peculiarities of Australia and look at the challenges they bring along to public health. We'll also cast a look at what needs to be done and what has been done to address this challenge. So, let's explore. According to World Report on Aging and Health, life expectancy has increased 20 years worldwide. People live closer to 80 years these days. Of course, these bring opportunities and benefits with this increased time. One could find time to follow one's creative pursuits, contribute to family and society, be productive, etc. But all this is really rooted in good health. Now, looking at the numbers, today the 60-year-olds actually outnumber the 5-year-olds. So, we're definitely looking at a greater age population in the future. Something that this WHO map clearly brings out. Canada, Europe, and China stand out, though the percentage of older Australians is still less than 30% of the population, but as this graph shows, they are certainly slated to increase. Now let us look at the Australian scenario. 15% of Australians are aged 65 and over that classifies as senior citizens, 50% of whom are women, and Australia enjoys amongst the highest life expectancies in the world, though it's a bit lower for the indigenous Australians. The Australian demography is made up of a diverse group of older people. It comprises the Aboriginal and Torres Strait Islander peoples, culturally and linguistically diverse people, people in regional and remote communities, veterans, and people at risk of homelessness. We shall look at each of them and examine specific issues. The Aboriginal and Torres Strait Islander people have higher rates of aging than the general population. 50 years and above age group comprises 17% of the total indigenous population, whereas the 65-year plus age group makes up for only 5% of the total population. Contrast this from the general population that stands at 15%. And this is what this graph demonstrates. The age spread is wider at younger ages for the indigenous people and narrows down rapidly as we go towards the older ages, quite in contrast to the non-indigenous group. This is another graph that shows the distribution of older indigenous people across different parts of Australia. While the non-indigenous people are spread more uniformly throughout Australia, the non-indigenous people are concentrated in pockets. These factors exert a unique challenge to the public health of this community. The next group of people is the culturally and linguistically diverse people. Changing migration patterns over the centuries leads to cultural and linguistic diversity. 37% of the older people are born overseas. They have differing situations and needs. Many speak another language, but less well so English. Also, refugees are another especially vulnerable group. They may have a lack of understanding and leading to underutilization of services. Health promotion and information dissemination form a part of their public health strategy. Next, we come to the regional and remote communities. This area needs attention in terms of geography, distance, and the fact that a third of older Australians live here. There can be issues with access to service, lesser number of GPs, and the higher hospital admission. Some unique risk factors in these areas include occupations, long distance driving, and associated country road hazards. The and even high rates of diseases are seen in these communities, including coronary heart diseases, circulatory diseases, motor vehicle accidents, and respiratory diseases. This slide shows the lost years of healthy life across different regions of the country. This is measured as a DALY, Disability Adjusted Life Year. So, the further away we are from major cities, the more lost years of healthy life we have. The veterans of the Australian Defence Force form another special group. Their affairs are managed by the Department of Veteran Affairs, and 69% of veterans are aged over 65 years. They have high rates of mental health problems and arthritis compared with the general population, and also their health issues might start much before they touch 65. Another unfortunate growing problem in the country is homelessness. Not only are the aged homeless more vulnerable, but homelessness itself contributes to premature aging and early onset of health problems. And given that the recent budget has hardly done much to address social housing, this issue is set to grow. So, let's condense all this together. What are the core public health challenges we face with older Australians? Changing health profiles and increases in chronic diseases are at the top. Arthritis and hypertensive diseases are most prevalent, but there are increases in all chronic disease as the age increases. Age-related disability is another challenge. We have managed to push the most severely disabling conditions to even the older ages, but the prevalence of less severely disabling conditions is still stable. So, at age 65, for an average of extra 20 years of life gain that we spoke of at the beginning, we can expect 8 to 9 years of disability-free years, and 15 to 16 years down the track, we could expect increase in disability with core activity limitations towards the end. Continuing with related public health challenges, we have increase in demand on health services and rising healthcare costs. Add to this the differing requirements we have for the different groups we mentioned previously. There's also slated to be an increase in dementia, increased demand for aged care services, and an increased need for supported home living. All this means increased coordination between different services, plus the need for information services. So, what are the best ways to meet these challenges? These are divided into preventive strategies and long-term care. The WHO recommends healthy aging that includes behavioral and medical risk factor control. Productive mental and social engagement is also encouraged. The other WHO recommendations are aging in place and creating an age-friendly environment. This helps older people to retain their independence and mobility. Utilizing e-health such as remote consultation, monitoring and tracking also help the purpose. The long-term challenges are met via building infrastructure, increasing the healthcare workforce capacity, and matching services to the population they serve. Alternatives to fee-for-service are recommended for universal health coverage. Continuity of care is important in the long term, so transition pathways are established between different care services. Hence, in keeping with all these objectives, Australia has devised several initiatives and programs. The Aged Care website is the repository of information. Special programs exist, such as the National Aboriginal and Torres Strait Islander Flexible Aged Care Program, Veterans Home Care Program, and Specialist Homelessness Services. Community nursing services help with supported living at home. Further aged care programs for health sector include government subsidized and funded home care services and aged care assessment. The CHSP program supports aging in place. New models for palliative care are being developed in aged care facilities to not just be restricted to the last days or weeks of life, but also for better end of life coordination. Quality and Safety Commission was established in 2019 to identify and respond to failures and keep up quality of care. A website has also been designed for people to plan their future years by way of online interactive checks. And finally, the task force set up for the aged care workforce delivers industry-led reports to the Minister for Aged Care. Hence, efforts have been made from grassroots levels up to the highest bodies of policy making in achieving better outcomes for senior citizens. In summary, older Australians is a growing population but are still independent and healthy and can expect further initiatives geared towards their well-being. Thank you very much.